That's what I love about groups. And it's a passion of mine for it's um, at this point, nearly 20 years, I've been teaching and facilitating groups and really just love that process and bringing people who might never ever have met each other and might be completely different identities and how to make it into a safe space, as much a safer space. It can't always be safe, right?
And it really is also that ethos of like democratizing access to this type of healing in medicine, because with the group model, costs go down, right? So it's not one person having to pay for that whole hour and a half. It's people sharing the cost and sharing the experience and also getting more out of it in a way, sometimes when they are able to connect with each other and have that social support component. With the group model, it allows us to do things a bit differently and have people actually practice the skills we're talking about and do life together a bit more.